Endometriosis is a condition whereby the cells which are similar to those that are found in the lining of the womb are found elsewhere around the pelvis usually, but can also present in different parts of the body as well, such that when the hormones which are used to regulate a menstrual cycle are in a certain stage, they can also flare up those cells wherever they may be, such that they give rise to inflammation, adhesions, and a lot of the symptoms that we know endometriosis is associated with. Endometriosis is quite a varied condition in that it can affect individuals completely differently, but typically the symptoms that we see are pelvic pain. Additionally, very painful periods to the point that it can stop one in their tract, mean that they need to take time off work because of the pain, and sometimes they can feel nauseous or even faint because the pain is so bad. In addition, going to the toilet can be painful, as well as intercourse, and all of these symptoms indicate something like endometriosis, but it can also present very similar to some other conditions, and that's why the diagnosis can sometimes be challenging. Hence why seeing a specialist is always advisable to try and ascertain the exact nuances of the symptoms to try and get to the correct diagnosis. Thankfully, most patients are able to conceive naturally, even with endometriosis, and some patients don't even know that they may have endometriosis until they've required a procedure or investigation later on in life, even after they've completed their family. So it's good to know that most patients are absolutely fine in terms of their fertility. However, we do know that in some individuals where they have had difficulty conceiving and they have symptoms of endometriosis, if we do investigate and find endometriosis and then excise it through precise minimally invasive surgery, then we do know from a lot of studies and from the literature that that can improve patients' chances of conceiving. We use a whole spectrum of different ways to try and diagnose and, of course, ultimately treat endometriosis. So we start off, as previously mentioned, with a very good history and examination, as that usually points us towards a potential diagnosis of endometriosis. Sometimes endometriosis can obviously be seen on scans such as ultrasound or MRI, but if a patient has less severe endometriosis, then because of the limitations of the scan, that is not always seen on scan. There are newer tests, thankfully, because of research which are coming out, which may help to diagnose endometriosis in a non-invasive way, but currently, if one wants to determine definitely if they have an endometriosis, if not shown on scan, then that would be through a keyhole procedure such as a laparoscopy. That also has the advantage of them being able to treat the disease there and then through surgical excision, which is the current preferred option with regards to surgical management. However, there are other avenues which a patient may wish to explore to try and improve their symptoms, because ultimately that is our goal. And through lifestyle changes, through specialist pain relief, and also newer and more advanced hormonal treatments, we are able to improve patients' symptoms related to endometriosis in most cases, either through medical, non-medical, or surgical means. I always do tell patients that lifestyle changes are important for general health and also can be relevant to endometriosis, so that we know a good diet, exercise helps significantly making people feel good and healthy, and can also help manage pain to some degree. Also, some conditions such as endometriosis can be affected by bowels, and we know that sometimes endometriosis can involve the bowels, but in any case, eating foods which may cause less bloating or special diets may also help to improve some of those symptoms. So good diet, exercise, and generally leading a healthy life with less alcohol consumption and no smoking obviously will significantly help symptoms overall, and indeed some of the symptoms of endometriosis. So when we follow up endometriosis, if it's been diagnosed or treated, we will tend to tailor this dependent on what pathology. Hello?
Hi.
Yeah, so, sorry.
No worries. I can read the question again.
Locked out then.
It's okay. We can repeat the last question.
Yeah.
Okay.
Sorry, just logged out. I didn't know you're still logged in.
No worries. Okay. How often should I schedule follow-up appointments to monitor my endometriosis?
Once we've diagnosed or treated endometriosis either through medical or surgical means, then we will tend to tailor how we follow up the endometriosis. For example, if there was a large ovarian cyst, which we call an endometrioma, which we treated, then we would want to perhaps do regular ultrasound scans or MRI scans just to ensure that those cysts do not recur and cause more problems. However, sometimes if the endometriosis has been cleared surgically and the patient has had good symptomatic relief and they didn't have really significant endometriomas, then a very good way of following up is through symptom control. And by patients keeping a pain diary and a symptom diary, we can quite reliably follow them up in terms of how they are feeling. And if there's any deviation from that, or if they are starting to experience symptoms as before, then we could initiate more investigation. So in essence, it will really depend on the patient and what pathology and type of endometriosis they had and how their symptoms are controlled in terms of how we tailor follow-up to them individually.